and put her here today, please.
Thank you, Chair. Two are actually new colleagues. John Harris has been with us a while, and he'll be presenting one that we...
next to him yesterday.
Yes, we'll be presenting one of our papers later. But we do have two colleagues who actually started yesterday, so they've both come... They're both keen to gain an understanding of how we do things, so they're both here to observe. So we've got Paul Moore, our new Corporate Director of Place, and then alongside him we've got Nick Cave, our Head of Local Government Reorganisation and Special Projects. So we're pleased to have them both on board.
Thank you.
And also we have an additional colleague, not here, but on the environmental health side. So can you just remind us?
Yes, we've had Laman Tamba start as an environmental health manager to support while Tracy's on sick leave.
Now, by reading out this, welcome to this meeting of the Community Wellbeing and Housing Committee. Please note that this meeting is being live broadcast to YouTube for the public to hear the proceedings, but not to see it today. So please turn on your microphone when speaking. May I also ask that members ensure that they turn off their microphone when they have finished speaking. May I ask everyone to check and turn off any mobile phones or switch them to silent mode, please. In the event of a fire alarm sounding, please follow the council officers out of the building and do not use the lift. But I don't think we're expecting one to sound today. Members are reminded if you need to leave the room during consideration of an item, please alert myself and we will consider if it's an appropriate time for a short adjournment. As Chair, I am entrusted to maintain decorum of this meeting. I would therefore like to remind councillors that respect is to be shown to all members and officers in the chamber. When someone is speaking, I would ask that other members listen and do not hold their own private conversations. Any members who do not respect this will be reminded. Turning to the agenda this evening, item 1, apologies and substitutions. I have received apologies from Councillors Attewell and Councillor Hawkins is in attendance as a substitute. Councillor Baltflower and Councillor Chandler have also sent their apologies. Does anyone know of anyone else, please? No? Okay, thank you. Item 2, minutes. The minutes of the meeting held on the 24th of March 2026 can be found on pages 5 to 8 of the main agenda. Does the committee agree the minutes of the meeting as a correct record of proceedings? Agreed. Anybody disagree? No. Thank you. Item 3, disclosures of interest. Does any member have a disclosure of interest to make in relation to any item on this agenda? No. Thank you. Item 4, questions from members of the public. Excuse me. We have received no questions from members of the public. Item 5, forward plan. This item is to note the forward plan for future committee business. This item can be found on pages 9 to 12 of the agenda pack. Are there any questions? No. Does the committee agree to note the forward plan for future committee business? Agreed. Thank you. Item 6. Environmental health, general enforcement policy, housing enforcement and civil penalties in support of the Renters' Rights Act 2025. This item seeks approval to adopt the proposed Environmental Health General Enforcement Policy 2026, the Housing Enforcement Policy 2026, and the Civil Financial Penalty Policy 2026. The report can be found on pages 13 to 108 of the agenda pack. May I ask Fidelma Bahoshi Joint Senior Environmental Health Manager, to introduce this report, please. Thank you.
Thank you, Chair. The committee is asked to approve 3 policies: the Environmental Health General Enforcement Policy, which is an existing policy but has been reviewed and amended, and 2 new policies, which is the Housing Enforcement Policy and the Civil Financial Penalty Policy, and also to delegate authority to make minor changes to the group head for placing in consultation with the monitoring officer. These policies are a response to the implementation of the Renters' Rights Act and ensure that Spelthorne has an up-to-date, transparent and legally robust policy. The Renters' Rights Act represents a fundamental shift in our approach to enforcement. There is a statutory duty to enforce, thus altering the balance between informal action and formal action. I'm just going to raise a few points from the reports just to drive it to your attention. So where breaches of Housing Act are identified, the Council must now actively consider whether enforcement action is necessary to meet our duties, rather than defaulting to advice or informal action as a starting point. The Association of Chief Environmental Health Officers has developed a suite of national model policies, including the Housing Enforcement Policy and a Civil Financial Penalty Policies. These policies are intended to promote greater transparency, consistency and robustness in enforcement approaches, while still allowing for appropriate local discretion. Other districts and boroughs across Surrey are also adopting these policies, supporting a consistent approach ahead of local government reorganisation. To draw your attention to the Housing Enforcement Policy, so this has been developed to reflect the changes introduced by the Renters' Rights Act and related housing and legislation. The policy establishes a clearer and more structured approach to enforcement activity, including when informal action may be appropriate and where the Council may proceed directly to formal action, particularly where there have been serious breaches.
Oh, sorry.
Serious risks to health and safety, repeated non-compliance, or breaches of defined landlord legislation. The General Enforcement Policy from Environmental Health has been reviewed and updated to provide a clear overarching framework for enforcement across all of environmental health functions, so not specifically relating to housing. And finally, the Civil Financial Penalty Policy has been introduced as a standalone policy to provide a transparent and consistent framework for setting and imposing civil financial penalties where legislation allows an alternative enforcement to prosecution. Thank you.
Do any members have questions in relation to the report, please?
Just an observation, first of all, if I may, and then secondly, I'd just like to ask you a question. It was good to see that the other districts and boroughs across Surrey, going into West Surrey and East Surrey, are actually doing this consistently across, which is very good indeed. Can I just clarify in the first instance that we are all on the same page, or are there any differences in terms of the adoption? Into the first question. Thank you.
As far as I'm aware, everyone is going ahead with the civil financial penalty one, but some already had existing specific housing enforcement ones that they're amending slightly to take in some aspects of the new suite, but they're not all consistent across the housing enforcement one.
Which is what I thought. So I'm just wondering, is there going to be any work, or whether or not we're going to wait for West Surrey to do the work on it later on, or are we going to try and look at where the gaps are across West Surrey collectively, or should I say collaboratively, in advancement of West Surrey, so that when we get to the 1st of April next year, we adopt a policy that is across the whole. Do you know that or not? Thank you.
I don't think they've made a final decision, but what I can say is there is a forum. So across all the districts and boroughs, there's been a renters' rights group that's been attended by all the districts and boroughs and fed into. So kind of we've agreed templates and letters and enforcement, but not all of authorities have chosen to implement them. But that is work that just continues ongoing.
And then my final question, if I may, is in terms of the, as you say, the fixed penalty notices. Are they consistent? Are they set from government legislation? Thank you.
there is statutory guidance for those, and that's what's incorporated within our policy.
Thank you. Does anybody else have any questions? Councillor Halkins.
Hi. Do I assume that this relates to the properties that we rent out that were within the Cage group of housing?
It would apply to all private sector housing,
Okay.
but not social housing, but I don't think that's social housing.
Okay. So, how many times have you had to enforce this to other homes and also to Cage tenants?
I don't have any details of what enforcement action we've taken, but if it's okay, I can look into that and come back.
Okay. How will you move forward in relation to the HMOs? Because I know there's a lot of charges and things like that. How will they be enforced? And as a tenant, you know, I'm in a HMO, I don't like it, you know, that I've got a bad landlord. How does that progress without me ending up on the street?
Renters' rights is specifically, one of its main areas is to prevent illegal evictions. And we have strengthened powers, and it's now, there's a statutory duty for local authorities to take investigations and to look at those areas more. It strengthens our powers for dealing with HMOs as well. So it gives us clearer powers that we can take for enforcement to protect tenants within HMOs. So it should make things better for us as an enforcement body, but also for tenants living within HMOs who have problems with their situation.
So have we now got an up-to-date list of licensed and unlicensed HMOs within Spelthorne yet?
We do hold that data, but we don't publish the unlicensed ones yet.
So how up to date is the unlicensed one? Is it very up to date, or is it something that you've only just started?
Do you mean like the backlog of new applications that we're working through?
No, I'm talking about unlicensed. Unlicensed that have never been licensed and probably never intend to get licensed.
We have a list of potential HMOs that are under investigation. There's about 60 on that list. So we're actively investigating that 60. We're working with colleagues in planning because with the Article 4, there's a bit of overlap now. So we're trying to work with them so that we're sharing information. When they go out, they will share with us. And when we go out, we will share with them. So there's much more collaboration, particularly because of Article 4.
Okay. So how many HMOs are there altogether then, apart from the 60 that you're now going into?
Licensed HMOs, I could give you a ballpark figure, but I don't want to.
No,
I mean, I can give you a specific figure.
No.
So we've probably got 100. This is a very ballpark figure of about 290.
Gosh, that's more than I thought. Okay.
So that includes licensed and ones that are in our system,
Yeah.
but doesn't include the 60 potentials because they haven't either applied and they're not established yet as licensed or as licensable as within scope. Because if they have 3 or 4, they wouldn't fall within our scope.
Okay, lovely. Thank you so much.
Terry, would you like to?
Yes, just picking up on one of Councillor Halkin's earlier questions in terms of enforcement action. So whilst not as closely involved with Nolgreen Estates as I used to be, to my knowledge, there's never been any enforcement action, and in particular, as you'd expect, of a housing management company wholly owned by the council. They've always placed great importance in terms of being a responsible landlord and having appropriate policies in place. Thank you.
What about that man that was in the Surrey about the article?
Councillor Bateson, would you like to? Yeah.
Thank you. I think that this Renters' Rights Act is a good piece of legislation, and more importantly, from the council's perspective, if it stops people being evicted by illegal means, and those people, as a result of that action before this act came into being, ended up being a problem on our housing department's doorstep, then if it's going to reduce the pressure on us to have to react to people who have been evicted and end up on the doorstep, then that has to be a welcome move for this council. So from that point of view, that's one of the best things that I've read in this Act that is very, very good. So it's to be commended, and hopefully the instances where we do get homeless people turning up on the doorstep will now reduce. Thank you.
Thank you, Councillor Bateson. Terry, do you want to say?
Yes, obviously I'm mindful we're in part one, and if Councillor Hamilton's referring to the incident or the case, rather, that doesn't actually involve a Naga Estates property. That relates to actually a council-owned, directly managed facility, and obviously there's a whole set of circumstances which isn't necessarily conveyed by the media coverage, but as I say, that's not really something to discuss in part one. Thank you.
Councillor Sexton, would you like to say something about HMOs, please?
Thank you, Chair, for allowing me to speak, but Terry's actually just pretty much said what I was going to say, and more importantly, I think that obviously this is to do with the renters' right, and any specific questions would probably be best left for officers to come back to. Thank you.
Anybody else have any questions? Councillor Buck.
Thank you, Chair. While I fully support the principles of improving housing standards and protecting tenants from rogue landlords, I must raise some concern about this policy framework. Now, first of all, the report asks us to approve major enforcement policies, yet there is remarkably little evidence on the actual scale of the housing problem in Spelthorne. We haven't seen the figures on the number of rogue landlords, no data on illegal eviction or dangerous housing condition or repeated offenders in our borough. Yet we are being asked to support a significant expansion of enforcement activity where a proper local evidence base, without a proper local evidence base. So this is my first question. Where are the data? How big is the problem? What's the extent of the problem? Thank you.
Fidelma, please.
I think it's just to kind of maybe go back to first principles. We need to be prepared for the worst case scenario. So we deal with a steady flow of complaints against landlords, whether they're related to HMOs or they're related to just general private sector housing. We need to be able to respond to those complaints with the best suite of enforcement actions that we can. And that's what this policy gives us. It gives us the ability to serve civil fixed financial penalties. It gives us the ability to determine the right level of those financial penalties. Some of them can be up to £7,000 for a first offence, rising all the way up to £40,000 for repeated non-compliance or the seriousness of offences that are committed. These policies gives us the ability to do that, and that's really critical that we have that, regardless of how many complaints that we get, which I can assure you I don't have the specifics how many we get per year, but we are a very, very busy team and we need to be able to respond. It also, these policies gives us robust framework for if there is appeals that are made against any decisions we're making as enforcement officers. So they're tried and tested by barristers, they've been looked at by our legal team, so they are robust and they will give us the best chance of defending any action that we're taking. When we take enforcement action, it is because it is repeated non-compliance generally, or if there has been a serious issue with it, with a tenant or a landlord. So we only take it when it is absolutely appropriate and proportionate. I think that's really important that we're clear on that. And even with the changes from moving from more of an informal base to a formal base, it will still always be appropriate and proportionate to what we're looking at.
Councillor Buck.
I've a couple of more questions, and I will just one by one just give you opportunity to answer. Thank you for answering that, but yet I haven't seen any data, so you haven't answered that question that I wanted to know. What is the extent of the problems? What you describe is what the policy is going to do, which we agree, but I just want to know what is the the history of it. How big is the promised platform? Okay, let's move to the second question, is about the financial assumptions underpinning this proposal. The report say there is no firm estimate of penalty income for 26-27, and only moderate confidence in recovery assumptions. Yet, at the time that we're being told the scheme is fully funded for enforcement income, this doesn't simply add up.
Sorry, I can't say. Yeah. I think what you're asking is how we're funding it. Am I clear?
You say it's about the financial assumption of this. I'm sure you made some financial assumption. Can you go through that? And then I'll ask my question.
Absolutely. So we're not expecting any financial income from civil penalties this year because we're still getting our policy sorted, and it's still an area of growth and understanding for the team. I am aware other authorities do include as income civil financial penalties as a source of income. The expectation from renters' rights going forward is they've provided new burdens. There's 2 phases of new burdens grants. That's all we're going to get to deliver this. The expectation is that civil penalties will then finance systems and teams moving forward. So a polluter pays concept. We asked for a growth bid for this financial year, which was successful for additional resource, so that we can ensure that we are going out there, we are doing the enforcement, we are working on our civil penalties. We've been working with the debt recovery teams to ensure that when we serve civil penalties, that it is then recouped, that money is then brought back into the council. Otherwise, there's no point really, is there? So it's about making sure that we are ready, and that's what we're doing now.
Yes. Sorry. Again, the report said this scheme is fully funded for enforcement income, which means I'm sure you have done a projection. You know how many million or thousands or hundreds are you going to get through this enforcement. Now, this is where you say it's fully funded, but it doesn't have because if there's no projection. I'll just give you an example. What happens if someone appeals against this and they succeed their appeal? What happens if penalties that you've charged cannot be recovered? So where would that money come? Will taxpayers end up carrying that financial burden? Or there appears to be like a over-reliance on penalties as a source of operational income? That's my question. So I wanted to see what's the financial projection you made, how many are you expecting, and how did you come to the point where you can say that this is self-funding? If you use the word self-funding, it has to be supported by some financial statement. You agree with me? Thank you.
Apologies, we're not at that point yet. So for this financial year, it is funded by a growth bid for additional resource. So that is how we're funding it this year. It is difficult to estimate how much we're going to have as income from financial penalties. That is difficult, and I can't give you an idea on what that will be this year or next year.
Can I continue on the enforcement of this policy and the operational enforcement of this policy? Because the report itself acknowledged increased complexity regarding appeals, enforcement activity, and then how many officers do you have to enforce that? For example, are you properly staffed? Do you have enough staffing capacity? Are they properly trained? Do you have enough experienced officers? And how do you model the workload? Because if we're going to apply this policy as it should be applied, so what's your preparation behind that? Thank you.
We've been working really hard to develop the private sector team within environmental health. So we've grown it by 2 additional housing standards officer posts. One person came into post in September of last year. The second has only just started in May of this year, but they are both experienced housing officers. So they're coming with a wealth of information, with a wealth of knowledge already. We're also looking to grow the team further, and the growth bid was intended to look at a tenancy relationship type officer to work closely with our colleagues in housing options. That would be more specific to tenancy issues. So that will be looking at eviction, illegal eviction. That will be looking at the abolishment of Section 21s and ensuring that landlords are adhering to the new rules from renters' rights. So we have spent a lot of time and effort growing the team to make sure that we are in the best position we can be to enforce it. We have had trouble within environmental health recruiting, and that continues. We've gone out numerous times to recruit to posts within the team, and we still have a vacant post, despite many attempts to fill that. It's a really difficult sector, it's a really difficult industry, and that's a common across Surrey, and that's going to be a West Surrey and an East Surrey problem to retain competent environmental health and housing standards professionals. It really is a challenge. We're looking to grow within. We have an apprentice within the team, so we're taking all the steps that we can to ensure that we're resilient and ready.
One more question. So you explained this very clearly, and there's no reassurance.
Sorry, can I interrupt, Councillor Buck? This is your last question. Thank you.
Okay, no problem. Just comment, and then I'll go to my last question. So there's no reassurance that you have the staff to implement this policy, and yet you want us to support this today. So let me go for my last question. Is about, in practice, every council has formal and informal enforcement. There's always a sort of resolution, informal resolution between, and this is the approach that's been adopted. Now, what will be the culture after the introduction of this framework? Are you going to go direct after the landlord, apply it into and try to extract their fines and money from them, or are you still going to balance it, to have it like a proportional approach? Thank you.
That's something, it's a cultural change for the officers as well. So we've always been very gradual with our enforcement. That was our existing enforcement policy, and that was in keeping with the Regulators Code. Renters' rights does not fall within the Regulators Code. So the expectation is, if there is a breach of this act, that there will be enforcement action taken. It will be proportionate, is all I will is what I can comment on, because that is what local authority generally is. We're always proportionate. We consider even the policy itself gives different things that for civil penalties. It gives different areas that we can consider. The landlord is within their rights to ask for mitigation as well and to appeal it. So with any civil penalty, we have to give a notice of intent first. The landlord has 14 days then to make their representation, and we can consider that and take that into account. So there is safeguards built in to protect the landlord from overzealous officers. We'll be working in collaboration with legal when we're doing these as well to ensure that we are within our powers and that what we're doing is correct.
Thank you. Does anybody else have a question on a different subject with regards to these reports? No? Thank you. Does the committee agree to 1, approve the Environmental Health General Enforcement Policy 2026, 2, approve the Housing Enforcement Policy 2026, 3, approve the Civil Financial Penalty Policy 2026, and 4, delegate authority to the Group Head of Place, Protection and Prosperity in consultation with the Monitoring Officer to make minor non-material amendments to the policies where required by changes in legislation or statutory guidance? Agreed. Does anybody disagree? Councillor Buck. Item 7, monitoring, sorry.
Sorry, we might have to go on to Stephen's item first because we haven't got Jack here. We're going to try and get hold of her.
Okay.
There's been a bit of miscommunication. Oh, do you want to say? So if we go to Stephen.
So we go to Stephen, yes.
Next, please.
Yes. Which one's that? Sorry. Goodness me. Number 8. Yes. Right. 8 is review of disabled facilities grant policy. Reintroduction of means testing for level access showers. This item is to consider an amendment to the Council's Disabled Facilities Grant Policy. This item can be found in the supplementary agenda issued 27th of May. May I invite Stephen Mortimer Cleverly, Borough Lead, Independent Living, Housing and Health, to present this report, please.
Thank you, Chair. We are currently in a position where we have unprecedented demands on the Disabled Facilities Grant. We have received a very flat award from central government in terms of the Disabled Facilities Grant in the region of £1.17 million for each of the last 4 or 5 financial years. The reason that we come to you this evening to amend the policy or request an amendment to the policy is that as that award continues, so it's an award from central government via the Better Care Fund that then gets passed on to the county council, that then gets distributed to the housing authorities in the county. Both in adult social care and in health, there's been an increasing demand around the level of comorbidities of our residents, the number of hospital discharges that require people to live independently for longer, a reduction in packages of care over that period, and the discharge to assess principles which accept that people should really try and live independently for longer, but that puts additional pressures on the Disabled Facilities Grant. So roughly about 5 years ago, we came to this committee to actually remove the means testing for level access showers and for stair lifts. And at that point, this wasn't the situation. We were effectively underspending the DFG grant. That situation over the last 4 or 5 years has completely changed. And this report lands here this evening because we need to do something. We need to help suppress demand, because once the grant has run out, there's nothing left. There's nowhere else to go in terms of accessing other funds to do adaptations for our residents within the borough. And the reason for the timeliness today is that you would imagine that we do it in a normal committee cycle, but we always have a great pipeline of referrals from occupational therapists, who are the people who do the assessment, to work out whether the works of an adaptation are necessary and appropriate for the resident. So this is a very strict process around a person's needs that are assessed. Now, our pipeline at the end of the financial year meant that we were looking at another £250,000 worth of effectively grant commitments for this financial year. In the first 6 weeks of this year, we had spent £300,000 of that 1.17 million for this financial year. So we need to do something as officers to highlight this to Community Wellbeing Committee, and our recommendation as officers is to tweak our existing policy to then remove the availability of level access showers to everybody, and to reintroduce a means test for level access showers. So we've put some numbers in the report to indicate what that would probably mean for the grant for this year, to enable us to stay within the grant envelope as we continue through the financial year. Now, it's not a very nice decision, I would suggest, for committee to make, because what we have to do is effectively tell some people that they're not going to get the grant to support their adaptation. They still get their OT assessment, and their needs may be assessed, but through the process of means testing, it might appear that they have enough funds to be able to fund the adaptation themselves. And therefore, appropriately, the grant is then attached to people who fall within the means test criteria and then are eligible for that adaptation. In all the papers that you've got this evening, there's a professional's handbook that I've attached now. There's quite a way into the handbook, but on page 40, We do, in the same way that environmental and health do, we meet regularly with all of our other D&B colleagues on the DFG subject. And we try and rationalise the process anyway for any Surrey resident. But there are local differences that are normally subject to this kind of committee's approval, or whether you want to think about local responses. Now, the one thing that really stands out on page 40 of that handbook is that D&B number 7, because they've all been anonymised in the professionals handbook, that's us. And we're the only one who don't have a means test for level access showers. Everybody else in the county do, and more importantly, everybody in West Surrey have a means test for level access showers. So there is some motivation to also dovetail us into a universal policy offer when we get to West Surrey. Under some of the local government regulations, there is the ability for this particular policy to dovetail over the next it's effectively two committee cycles or 2 cabinet cycles in the new authority. But it makes sense for us as officers financially to try and curb some of the demands on the grant, and then to also dovetail into some of the principles around LGR and creating a unified common policy across the six authorities that will join West Surrey. I won't read through the report. I think I'll stop there and just ask for questions.
Does any member of the committee have a question to ask? Councillor Sexton.
Thank you, Chair, and thank you, Stephen. This is not a nice one to even consider, to be honest with you, because there's so many people that obviously wouldn't be asking for this provision if they didn't need it. Can you tell me, again, I know we're trying to support a consistent approach across West Surrey, but are we disadvantaging people sooner rather than later? And are we in line with West Surrey, etc., in the first instance? Thank you.
I think it's a really good question. My concern is that we end at the end of the financial year busting the budget, and we haven't got any additional provision for that. And that's why I feel the urgency in this committee is that, yes, I think what we've done is we've done a bit of an impact report, Councillor Sexton, and we cannot deny this is a really difficult one, because nobody really goes into accessibility tourism. Nobody really wants the adaptations in their own home, and whether they can afford it or not, it's a really difficult life decision. So it's not something that we want to do lightly, but I don't think we have that. I feel as if we don't have another option available. I'd love to give another option, but I don't think we have one. In the past, we got ourselves in a really fortunate position by the partnership with A2 Dominion. So for a couple of years, we always recharge A2 Dominion for any of the adaptations that we do on their properties. And for a while, it took a while for that recharge to come back into the building. What that gave us for a couple of years is effectively an unrealistic buffer, because we could access that. Whenever we get DFG monies back in, we recycle it for adaptations. So we had a couple of years where we had overshot our government grant allocation, but we were tapping into ring-fenced reserves from the A2 Dominion recharge. So we had created a situation where we were overspending the official DFG grant. There are loads of reasons for that, and what we're hoping to try and do is sync all of this together. Is that there's an amazingly efficient DFG team in the borough, top 10% in the country, which is fantastic. The partnership working with adult social care locality has been exemplary across the county, and as a result, we're really focusing on the necessary and appropriate need, but we're also getting through those applicants at speed as well. And you can't really slow this work down. When you see somebody in need, you just get on and do it. So that's one of the aspects. In conjunction with this policy change, which adult social care are really supportive of, is that the front door to adult social care has changed as well this year. So there is much more of a strengths-based approach which is difficult and is going to raise issues for our residents and generate complaints. But what that approach is from social care colleagues is that you ask whether the family can do anything first, whether somebody can help you with the grab rail, or so there's those. We're trying to, as a system, we're trying to triage some of those issues before they land in the DFG inbox. Hopefully, with some of those changes, it'll put a slight lid on demand, but we are also a victim of the current landscape in terms of health and social care and all of the other issues. So I'm really going round about, and I can't. Yes, we are going to disadvantage people this year. We are going to do that because some people who will then fail the means test will decide not to have the work done. And that's the real difficult bit of the decision making here.
And if they can't have the work done, then we're not helping our residents and they're disadvantaged.
Yeah.
One quick question about the means testing. Have we looked at last year's? Have we looked at those that have been lucky enough to be able to get some support in terms of what that would look like in terms of if they had been means tested? Has there been any way of evaluating that? Just trying to get a steer, if you understand where I'm coming from, in terms of the cost of living crisis, those that are struggling out there at the moment, and in terms of whether or not we're moving too fast. Listen, I understand we have to save money, I get that, but not to the detriment of those that need the most. And I'm worried, genuinely worried, that we're moving forward quicker than the rest of West Surrey combined in bringing in policies that are much more rigid now to the detriment of this borough. And I'd like a bit more information, please. Thank you.
Yeah. So I think it's a good point. I think what we're doing is, you might, with respect, Councillor, you might say we're levelling down to the others. All the others already apply a means test for this particular adaptation. So we would be levelling with the rest of the West and the East in this instance. I think it's a really good point about the numbers. So we've looked at the numbers. So there's two aspects to this, is that the means testing system that we apply to DFG is different to the adult social care means test. It's something called Ferret, which is a nationally recognised means test. So everybody does the same means test. So in terms of an audit trail and governance, we know that we're applying the right test. In terms of numbers of people who would have missed out last year if we'd applied it, there is, in the last 2 years, there's somewhere between 8 and 12 families who have had a level access shower who would not have had it if we'd applied the means test to those families. But we don't stop there, though, because we do have a case manager who works on the aspect of planning your works. And some of those families we've had success with by referring them into voluntary sector partners, ex-forces, for example, get a great deal of support around adaptation. So we don't just leave the family, we then try and support in a much more holistic way with the caseworker and our team of social prescribers as well, to try and get additional support. But there is a group who would miss out. The reason that they fail the Ferret test is that they're in receipt of typically, I suppose the brushstroke is, if you think of somebody who's eligible for pension credit, then they're likely to get the adaptation. If somebody's got some private pensions coming in, it soon tips them over the means test, and it also looks at their partner. So it's not just the individual, it looks at the household income as well. So it really assesses their financial capability to do adaptations.
And that could be a very small amount indeed, that could tip them over the edge.
Yes.
Okay,
Yeah.
I can't agree to this policy. Further questions, thank you.
Okay.
Councillor Arnold, do you want to ask a question?
Has a equality impact assessment been undertaken on the proposal to reinforce means assessment for level access showers, just to make sure that, you know, particularly low-income, older owner occupiers who may be asset rich and not cash
I think that's a really good point, Councillor Arnold. So I did do that impact assessment, which is one of the appendices. I think it's a really difficult one on the... So we do have lots of residents who are asset rich and cash poor. The potential is that they would still pass the means test. If they're income poor, then they're likely to still pass the means test. So it doesn't necessarily disadvantage an owner-occupier in this piece. And if we have our typical client that we sometimes think about, yes, they could have the asset being the house, but they still could meet the income criteria to pass the ferret means test to get the adaptation. So it's sometimes not, it's a bit more nuanced, I think, than just having the property asset.
One more, if you don't mind. Got one more question, if you don't mind. Okay. If level access showers recognised as a preventative or intervention that reduces falls and hospital admissions, why is this adaptation being selected for means testing rather than any other adaptations?
So I think that's a really good question. So the only thing left in our potential policy response to the issue that we're landing on is this or stair lifts. So the two things that are left, and it's similar to the earlier conversation, it's very difficult to grade any of this stuff, but if you were looking at your own mobility, I think the last thing that you would want is the stair lift. And we could have come today with both options in there to means test both of those items, and then we could have given you a very different number on the impact on the DFG. I think if we come to customised stair lift, there is a different conversation as well, by the way. So if it's a straight up and down stair lift, then you get the lift provider, which there are 3 of in the country, to then do the sketches, get the quote, and then the grant just pays for that. But I think it's a really good question, Councillor Allen, because I keep using this term a lot recently. It's like a Hobson's choice, because we don't really want to present any of these options to you, but we're so limited by the grant award, which hasn't been reviewed, and in fact has been reviewed for the next fair share agreement for the county. And the bad news is that we're probably going to get less than we currently receive because of the new fair share calculation. So a bit like Fidelma's conversation as well, some of this is preemptive because we just want to get ahead of what we think we're going to land on, which is jumping out of the budget envelope, ending into a new authority. And I don't know what happens when we overspend our DFG budget when we haven't got any other budget to tap into.
Okay, thank you. What happens if no one agrees to this?
So I think it's a really good point, because I was thinking about it on the way in the car. And I got in a cold sweat, to be honest, because there will be an implication, I'm assuming, for officers in this landscape, because it's my job to tell you that we're probably going to overshoot the budget envelope that's already been agreed in the budget. And if we're going to do something like we've done before, that could be £200,000. So as a budget holder, I've yet to see what that looks like, but I'm sure there will be implications.
Sorry, Stephen, I think Councillor Karen would like to speak.
Hi. Sorry, I was just going to say that in terms of the Hobson's choice, which I completely agree, the alternative is that we turn off the tap altogether, say no more other people also in huge need, people who might, have a new identified need in, say, August, September. Sorry, we're not going to help you at all. So we don't help people at this end of the process or other people. But just to also say that there is a statutory requirement to assess all grant applications for this within 6 months. And if those people say, apply to us in September, we've turned off the tap, then we're also likely to be in breach of those kinds of policies and things like that. So it's a real Hobson's choice. You've got budget balancing, the real needs of all sorts of people and everything, our statutory responsibilities and so on. So there are no easy choices, but we could make the choice, you may well make the choice not to accept this policy decision now. However, further down the line, because of the budgetary restrictions, we might then, as a council, be forced to do other hard choices.
Thank you. Councillor Grant.
Thank you, Chair. I understand one of the reasons here is to bring us in alignment with other councils. Now, I'm a bit confused by this kind of booklet that is part of this housing options booklet, or whatever they call it, because, well, from about page 33 onwards, they've got these charts where they're comparing different districts and boroughs, but it's not at all clear who they are referring to. Now, which one of these is Spelthorne, and is there any reason that for different colours, some of them are green, some of them are blue, some of them are orange, and, you know, it's all a bit vague.
Thank you, Councillor Grant, because that's the feedback we gave as well. So this was not being rude about our county colleagues, but this was a county-generated document that me and Karen, as group head, had quite a lot of input in. And we kept saying, we need you to name the authorities in the booklet, because that'll really help us, because we give some really good examples of the good work that we're doing. They refused to, Councillor Grant, so they refused to name the councils in the booklet. But for your info, we had D&B number 7, which is the one on page 40 where you can see is the colour coding, you're right, it makes absolutely no sense whatsoever. They just tried to differentiate between the groups of authorities. So I think it's very good feedback, because it was our feedback as well. Please name the districts in here. But this was an attempt to homogenise the offer when they were. This is a booklet for OTs in practice in the county, rather than a document for residents to try and navigate their way around.
So, D&B 1, 2 and 3 being green, 4 and 5 being blue, etc. doesn't mean anything.
No, absolutely.
Not much point in doing it then, is there? Councillor Hawkins.
Hi, I've got a couple of questions. The land registry chargeback, is that commonplace? What happens if the person, so basically if you've got a property, they're going to put an attachment of to your property.
Yeah.
If you haven't, obviously they won't. Is this interest added on or what?
So it's a very common policy to apply a land charge for an adaptation. It has a decreasing formula that Karen might be able to help me with, because I don't know the exact numbers, but over a period of 10 years, that diminishes. So in year 1, if the property then is sold by the family, then there's a charge applied on. So quite interestingly, Councillor Hawkins, we do get a lot of requests, because you can imagine that some of these adaptations come later in life. The family then inherit the property. We get quite a lot of solicitors ringing us and asking us to discharge the land charge, as you would imagine. But it's only appropriate, and it's within the statute. It enables us to claw back DFG that we've invested early on in that process. After 10 years, that charge completely disappears. Yeah.
It's ironic when we go and lend money to some people and we don't even put a land charge on their charge on their property, and they end up going into bad debtors. But anyway, that's by the by. We got a disabled grant of nearly 1.2 million. Can't we turn around and use some of the money from that towards this? Because these are disabled people.
From what, sorry, Councillor Hawkins? This is the Disabled Facilities Grant that we're using.
So, but has that grant been reduced or what?
It's important to point out that we, as an authority compared to many other authorities, we have fully spent every year, if not overspent. So we are struggling because it's going to go down in future as well. So we are using every single penny and trying to eke it out as much as we possibly can. We're fully utilising it.
Because they didn't turn around and tell us on the other day that this was a reduced grant. The Chief Exec didn't.
It's, I don't know what you're referring to, but it's not
on
reduced.
on the Chief Exec's meeting, not this one gone, the one before.
It's the government do the formula for how much each authority gets. So at the moment it's very consistent. It will reduce the following year, but we are fully spending it, but some of our neighbouring authorities don't.
Okay, so, right, and one last thing, I suppose going back to your thing of this is so we're supposed to pass this, blah, blah, blah. You've attached this booklet and it gives us, on page 51, it gives us the thing saying, what's the title of it? Housing policies per borough and district, linked to DB housing policy, DB1, blah, blah, blah. None of them links work. So it really is a pretty useless paper. I don't support it. I don't think it's right that we're turning around and picking on people that wouldn't come to the council. I've got a neighbour and he literally has one light on and a telly like this. He has no money. He lives off his state pension and top up. He doesn't know thing. And you're turning around and saying, well, you've got to turn around and come to us with all your thing and we'll see if we can afford it. No, I think it's wrong. And I think that, okay, it might cause problems further down with West Surrey. Well, let them deal with it. Let's turn around and hold our heads with pride, as with Spelthall.
Sorry, just I fully hear what you're saying. It's down to yourselves to agree or disagree, whatever is appropriate. But I'm afraid to say it's this year. It will impact on our residents, whichever way. Some people at one end of the equation or the other will suffer. It's not just the future that we're concerned about here. We're concerned about in-year expenditure.
Thank you.
Thank you. Does anyone else have a question? Councillor Bateson.
I think we all share the concern that the decision we make tonight is going to have a major impact on some of the most vulnerable of our residents, and you know, I'm struggling with it, as I think every other member in this chamber is. Now we are in a position where we're being asked to make a decision now in July, when we're just about a quarter, just under a quarter into the new budget year, and it's based on the premise that if the projections are correct, then we are going to at some point overspend the allocated grant. But what never comes into play with decisions like this is the savings, as Councillor Sexton said earlier and Councillor Arnold, savings about stopping people from falling. Walking showers is an example. The amount of times that I've heard of instance from some of my most vulnerable residents, they've had yet another fall in the shower. There's a cost to the country, a cost to the National Health Service, and this is not factored into this. So whilst on our budget it saves money, that the knock-on cost goes in to the National Health Service. So it doesn't, in most people's minds, most lay people's minds, it doesn't make sense. It just doesn't make sense. And I think the coward's way out is to agree to this tonight and let those who are the most vulnerable bear the brunt. My conscience won't allow me to do that, and I will not be supporting this. And I think we do really need to highlight this a bit more. But I think this is a very emotive thing. But I don't know how we get it across that by doing some of these things, if you stop somebody having a fall, they end up, God forbid, breaking a limb. They're in hospital with all the massive knock-on cost. It's not, in the grand scheme of things, it's not really a saving at all. Thank you.
Terry.
Yeah, so as everyone in this chamber has rightly highlighted, this is a difficult issue. And so firstly, just in reverse, picking up on your comments, Councillor Bateson, in terms of the the disjoin between different parts of the public sector. So yes, you're right. A more joined up system would take into account the preventative benefit, and hopefully that is actually one of the opportunities of moving into a unitary, because at least because by helping people live independently, healthy, longer lives in their own homes, that actually reduces more expensive costs in terms of people going into residential homes, which at the moment is a cost for the upper tier authority in the county council, whereas in the unitary that will be put together. And Stephen is involved in the work stream in the LGR transition, which is really, and he's doing some really good work raising that and making that case. But as Karen has said, we're currently in this year where we have a fixed amount which is passed via the county council from central government, and the reality is that that funding is not enough to meet the demand. That demand has been getting bigger, and the team have been really creative in the last few years and drawn on additional funding streams, that those funding streams have come to an end. So it is a challenging position, and obviously we've got the additional focus in terms of the financial challenges we face as a council. It is a challenge, and hopefully maybe West Surrey will take a more joined up approach, but we can't really presume or make a judgment about that, because that's a future decision by them. So we, as Karen says, we need to be focused on the in-year position we are currently facing. Thank you.
Thank you. I'd just like to say something as an old person, which I am. Your inclination to fall is much greater the older you get anyway. There's not a lot you can do about it, even if you try and put your home in such a state that you won't fall over things. So I don't want to vote for this either, I have to be honest. I don't know, but I don't know what the answer is. The other thing too, because it does put pressure onto the health service. Having worked for 9 years on the care of the elderly ward, I know what it's like and the number of people that came in with falls and that as a nurse, and I don't know the answer, is all I can say. Councillor Grant.
Thank you. A little supplementary question. This is all about types of adaptations to showers, but some of us have baths. Do any adaptations to make baths easier to get in and out of?
I think good question, Councillor Grant. What we typically do with the level access shower is remove the bath completely, so it creates a completely flat surface, so you can walk in and out and use the adapted handles rather than the climbing in and out of the bath is one of those key danger points for frailty and fall, so they're typically removed in this process. Those adapted baths that you see were not really fit for purpose and cause massive maintenance issues and warranties. So nobody in the adaptation sector really uses those for council adaptations. Can I just go back on Councillor Bateson's point as well, because we are, Terry's right to point out that we make these points very vocally in both the new West Surrey board and with our county colleagues and with our health colleagues. And despite all of that and the awareness of the impact on frailty, we are seeing a reduction in support financially across quite a lot of our services. We run a 9-bed step-down scheme which enables people to step out of hospital who are medically fit, hold on to them for 6 to 12 weeks and then move them back into independence. And it looks like that there are risks around all of those budgets because of Surrey Heartland's reorganisation and reduction in funding. So, and some of the award that we got this year was also top sliced before we received it. So we're in a difficult landscape. It is a horrible decision for anybody, any of us to make. You all know that. But I think we've got a responsibility as officers to present it, I think, and see what the committee decides.
Sorry, I'd also like to add something, that more and more people are living longer. So therefore it's going to be a problem that will increase, not decrease. Thank you.
Thank you. I know we need to move on. But I just want to highlight something because I'm not happy with this government or the previous government. We want people to come out of hospitals. We then try to help them live at home, and then those that are trying to have some sort of decent life at home with the provisions that they've spent all their lives putting away for in their pensions, and then the means tested, and then they get to a point where they have nothing, and then their lives change for the worse, unfortunately. I went to see a gentleman last week who I've known since I was a little girl. He's lost both his legs, can't move. Went into hospital. Adaptations have had to happen in his house. I cried when I left there. And the amount of things that went on and the fight that he had to get support after working all of his life, hardly any money left to even maintain his house, was absolutely deplorable. I can't vote for this. I need to understand what the shortfall is going to be, and we need to find that money this year. Thank you.
Thank you, Chair. Tonight, I would like everybody to stop and think about a very important thing. We are discussing how this council is going to support the most vulnerable resident, their disabled resident. And it is a very important responsibility for the council to support them to live independently. And this also aligns with the wider priorities of NHS long-term plan, which emphasize on prevention, independent living. And this is the direction of travel. This is where we are going. But reading the policy carefully, I'm very concerned about one thing. The policy doesn't put the resident first. The policy is about administration and process first. Okay, never mind, let's move on. So the most alarming section of it was, how long will the process take? And the policy states, I quote, Spelthorne Borough Council have up to 6 months to approve a fully completed application form and aim to complete the work within 12 months. 12 months. This is how long the process will take. But is this a reasonable time frame for someone who is unable to access the toilet, for someone who cannot use their bath, someone who cannot get out of the bed? Is this reasonable to keep them? Is this the way how vulnerable residents will be treated in this borough? This is a very serious issue that we are talking. Would we like to see them trapped upstairs for months? And is this independence? What happened? Research shows that someone who is trapped in the bed will deteriorate quicker. They might even, their life shorten because of that. There's medical evidence on that. My second concern is about the £30,000, and that may require to pay additional costs. So where in the policy does it explain what happened if a disabled resident simply cannot afford the shortfall? So where is the hardship protection? Where is the reassurance that the low-income family already under pressure, what would they do? And then come the land charge that my colleague Karen has already spoken. I'm not going to repeat it. So looking at that also, there's another part of the policy stating that the DFG is for homeowners, and the adaptation is over 5,000, a land charge will be placed on the property. How we work out what's the cost of having all these land charges, and how long the council, how many hours of workforce the council will use if they have to enforce all this. So this is another thing that we probably need to look at closely in this policy. And the other part of the policy relies heavily on occupational OT assessment, stating the council closely work with Surrey County Council and Social Services Department, who will assess the needs of the client. do you know what is the waiting time in Surrey? Have you looked at this part? Have we looked at the delays, the support, the resident, the receive wise?
Councillor Buck, Karen Sinclair will answer.
Just, can I finish and then you can answer? Okay, I can stop. Go on. Yeah, and then I'll continue. Yeah. So these are the things about the gaps that I identified in this policy, and this can be a very big obstacle for residents, especially when it comes to eligibility. So I'm going to stop here, give you the opportunity to reply. Yeah.
So I would like to say on behalf of us, collectively as a council, the work that we have done to support disabled facilities grants is, as Stephen has said, we're in the top 10% in the country. And so the thing that you mentioned about having 6 months to agree an application is a legal, that's the requirement set by the government. If people apply in Spelthorne and all the documentation is there, we are turning those around within a week, 2 weeks. We are outstanding. And in terms of the length of time to complete the works, if people put in their application, we turn it around. Small works we are completing within a month, 6 weeks. Larger works, 3 months, 4 months, because we have so streamlined all of the processes. I am so proud to work for a team that supports this. So what you're quoting are the kind of national figures, the national targets, the parameters that we have to work within. We exceed those beyond all expectations. And your point about the maximum grant of 30,000, again, that's set by the government. That's a statutory figure. What we do is negotiate, because often, I totally understand, people need additional, for example, ground floor level access shower. To build an extension, if that might be needed, would usually cost a lot more than that. What we try and do is be very creative. How can we adapt some of the living space downstairs to do that within the framework of the £30,000? We work really hard to bring costs down, to work with the builders, to do everything to do that, to avoid having to spend more than the 30,000. If it involves children, we will apply to Surrey County Council to see if they are able to top up, and we've been really successful in doing that, going back to our innovative use of money. So I just want to reiterate that as a committee, we should be really proud of what we have achieved in that sense. And in terms of waiting times, locally, sorry, could go on all day, the waiting times are very low for our residents at the moment. I can't quote for the whole of West Surrey, but if an occupational therapist referral comes to us, we turn those around very quickly, because we have the best team that I think you'll probably find in the whole country, and I'm going to say that without shame. Thank you.
Thank you, Chair.
Councillor Bateson, and then can we have this as the last question on this subject, please?
I have an additional question. I haven't finished. Chair, I haven't finished. I stopped to give opportunity to answer. Are you going to deprive me asking question on behalf of the public? I think this is the second time that I've been deprived. My hands have been up, and for long, so many people who raised their hand before me were given right to speak. Can I ask you to chair this meeting fairly?
Be polite. I do what I see, okay? If I see your hand up first, I go to you first. If I don't, I go to the other person that I've seen first.
Would you allow me to continue?
Please continue.
Thank you. I'm pleased to hear that we don't have a waiting list to process that. But from the point of view of a resident, the waiting starts from the time that they have to do an assessment. The OT assessment waiting time should be included in the wait time, right? Because we don't know how long they will take to have an assessment first. Then after the assessment, before they come to processing, going through all the formalities we just mentioned, means testings and all that, there's a lot of time. It's not 2 weeks. I wish it was 2 weeks. We were very happy if this was the case. But if we had such a very nice and dashboard that we can be very proud, there's no commitment to publish these figures. What's the average waiting time? What are the backlog figures? Resident satisfaction, are we taking that into consideration about complaint outcome? Or, You know, all these need to be monitored in the policy, because it's not a question of just giving them this service, but to see how we are supporting them, because we're talking about the most vulnerable people of this community. And I think we need to probably relook at this policy, tighten a bit, and make sure that we have safeguard in place to measure whether we're doing better or doing worse in case what happened if it goes beyond the 12 months, and what's happening to the resident in the meantime. They're going to deteriorate, they will end up on a hospital bed in NHS, which defeats the purpose of this policy. This is what I'm trying to explain. Thank you.
I think really good points, because it gives me an opportunity to tell you some of the stuff so that the information that gives us the top 10% in the country is via the Delta return, where we have to submit to central government around the use of the funding. So that's measured by central government in terms of a Delta return dashboard that enables them to look at the level of work that we do. I understand the frustrations about the timescale, even though we've tried to concertina that as much as possible. But the only bits that take longer in this process are either landlord permissions from the social landlord or the OT assessment, which you quite rightly point out. We have a very good partnership arrangement with the locality, though, which means that we do those at speed. But that is out with our control in terms of that. We can't be held responsible for the time limit for an OT assessment. Despite that, we have looked at getting some level 4 assessors trained, because you can actually put some of the clients through level 4 assessment. Now, what we do is we triage some of those clients with our trained level 4 assessors here. But it still needs to go through the cycle of an OT assessment to get the necessary and appropriate recommendations that then drive the rest of the DFG process. On top of that, we had a DFG audit quite recently, which, to Terry Collier's surprise and others, well, not to his surprise, he maybe expected it, but there was no feedback from the audit. There was no recommendations, because the team were doing everything in their power to spend the grant appropriately. And I know that sounds unbelievable tonight, but it's not the sales pitch. The officers are here to demonstrate that is the case. Now, for me, on top of the monitoring that the county do on so they pass the grant down for DFGs and handy person, but they also monitor us on a quarterly basis against our other D&B colleagues. Now, again, they will never tell us how great we are, but we do really well in terms of client turnaround. What we also have the oversight of is the Ombudsman as well. So if any of those issues that Councillor Buck highlights, if we go out of timelines, if we get a complaint, then we handle those complaints as you would imagine in the council, but then that gets escalated to the Ombudsman. I think we've had one of those in the last 3 years, and that is typically the Ombudsman complaints are about residents not getting what they want rather than what they need. And so I think that demonstrates that we have quite a good governance and audit trail about what we do. That aside, Councillor Buck, I do understand that when somebody's ready to be discharged from hospital, you want it all there and then. And there's some aspects of what we do, which is that disregard that enables us, if the hospital ring us, and our team can then access the contractor from the dynamic framework, we can have a key safe, grab rails, temporary ramps in within 24 hours and facilitate that discharge. That's why that disregard is there. And you're right, if they're stuck downstairs and the toilet's upstairs, then there is things that the OT can do around commodes and temporary fixes to try and get people home, because everybody's motivation is to get somebody out of those pyjamas back home. But there is quite a lot of really good system working around this as well, and it is frustrating that there just isn't the resource there to do what we want to do.
Sorry.
Sorry, I think we do now need to get to the vote, please. So does the committee agree to 1, approve the amendment of the Council's Disabled Facilities Grant Policy to remove discretionary means test
Excuse
exemption
me, can
for
we have
level
a named
access
vote,
showers.
please?
Sorry.
I just wanted to say, really, I just wanted to say, before we go to a vote, reading the mood of the chamber, I don't think this, if it goes to a vote, is likely to be passed tonight. Therefore, on that premise, can we not defer a decision until the next meeting? And in the meantime, as Councillor Sexton has suggested, and I agree with it, see if we can go away and look to see whether we can get some finance for another quarter to plug the gap. Because I think if this goes to a vote tonight, it's going to fall.
If I can just come back on that very quickly, Chair, I'm sorry to interject, but we did so on Meals and Wheels, if you recall. We went and found some
Yes, we did.
money for that, and I thank you, Councillor Bates, and I do think we genuinely need to. What is the shortfall approximately? Can I just clarify?
It's an order of magnitude way and above what we found for the for Meals and Wheels. At least £200,000. We're going heading for a significant budget gap. Yeah.
So really what we need to do is we need to be very mindful of what you just said. 200,000 is a huge amount of money, and we need to be very pragmatic in terms of whether that's realistic or not. But I do think that we should delay this, as Councillor Bates has said, and then to see what we can do. Thank you.
Terry, sorry.
Thank you, Councillor Bateson and Councillor Sexton. And yes, I think we are picking up those signals from the chamber. So we could go away. Obviously, if we and we could come back to the next one. Obviously, if we then made the same decision as now, then there'd be less impact in terms of another 3 months would have passed in terms of the savings which we might have achieved if we made the decision today. It is an interesting comparison with the Meals and Wheels when we did have, this is a very similar challenging and as Stephen says, this is not a decision the officers want to be putting forward. This is a tough decision, so we could go away, look at some additional options, but I would just manage expectations. I think we're not going to have, I mean, obviously we can explore, but I'd be extremely surprised if we found any external additional sources of funding, because as Stephen and Karen have said, the realities, particularly from the NHS, that the funding streams we've had in the past have been turned off. So that is reinforcing the challenges we've got at the moment. But we can look at some options and we could come back. So that's definitely one approach if that's what the committee as a whole wishes to direct to officers.
So can I ask, does the committee agree?
Seconder.
Oh, seconder, sorry. Who's proposing? Chris. Who's seconding? Councillor Arnold, thank you. Does the committee agree to postpone this to the next meeting? No, I'm not sure when the next meeting is. September. So that we find out some more options rather than just go ahead with Councillor Bateson.
And I think it's fair to the residents that we are challenging this, not in any way discrediting what the officer is saying, but I think we can hand on heart say we asked it to be looked at again, and if it comes back in September with the same result, at least we have tried. I think we demonstrate to our residents that we haven't, we've really challenged this as councillors right across the board to see if we can eke something out of it. But it's certainly something in West Surrey that I will certainly be raising about a much more joined up approach going forward in the new authority. And that's one thing I've taken out of this tonight. Thank you.
Can we ask the officers, please, to look into this in more detail, please? Thank you.
Really sorry, Chair, and can we try and ascertain, in terms of the other districts and boroughs in West and East, what the differences are? Yeah, where you can. I know they're not going to say who they are, etc., but how far away that we are from them, because for me that's quite scary.
We could
going
give the
into
find the numbers out. And
yeah,
the differences.
well, as much as we possibly can, because
Can,
obviously
and-
we're going to go into West Surrey on the 1st of April.
Yeah.
And that is going to have, you know, if we are in the top percentile in terms of what you said, that's going to have a massive impact on our Spelthorne residents, and we need to know that. Thank you.
Also going to make the difference between some residents coming home or staying in hospital, and we know there's a pressure on the hospitals and the beds there, so we've got to look to see. So
Does the committee agree?
does the committee agree, sorry, I'm getting old and gaga myself, does the committee agree to defer this until next meeting, please? Sorry, anybody against deferring it to the next meeting? No. So we agree that we will defer this to the next meeting. Sorry, we have to go backwards now, back to item 7, the monitoring and maintenance of Spelthorne CCTV assets. This item is for the committee to consider the council entering into an inter-authority agreement with Runnymede Borough Council for the delivery of CCTV monitoring and maintenance services. This report can be found on pages 109 to 120 of the agenda pack. I was going to ask Jackie Taylor, who is not here, Group Head of Neighbourhood Services, to present this report.
She should be online, if she can hear us. Jackie, can you hear us?
I can, yes, most definitely.
Oh dear. So Jackie, can I ask you to present this report, please?
Yes, most definitely. So, as you said, this report is asking the council to approve the Spelthorne Borough Council entering into an inter-authority agreement with Runnymede Borough Council for a term of 2 years plus 1 further year, which would be subject to mutual agreement between both parties. And that's actually because the current CCTV contract ended with Runnymede ended in March 2026, and a new agreement is required to ensure continuity of service during the transition to West Surrey Unitary Authority. The council, under the provisions of the Local Authorities Goods and Services Act, the council can enter into an inter-authority agreement with another local authority to supply the other local authority with services that are required, and also that agreement will actually contain terms in consideration of payment and anything else that we require as part of that service that we want them to deliver for us. So basically, it's the same as a contract, but an inter-authority agreement instead. So under LGR, we need this short-term inter-authority agreement so that we can transition to local government reorganisation, and the West Surrey Unitary Authority is expected to assume responsibility. I apologise, there's an error here. It should be 27/28, that's at 14.1. But until that time, Spelthorne Borough Council remains accountable for service delivery in the interim. So that's during the remainder of 26/27. It's also good to note that the contract will include provisions to address the fact that we're going into LGR, ensuring that on vesting day, when we do transfer to West Surrey, the agreement can either novate the new authority or be terminated without penalty, but it's very likely that we will just novate the new authority. And that term actually provides the flexibility, protects both parties, Runnymede and ourselves, and ensures continuity of service while avoiding unnecessary financial and legal risk during transition. So that's the request that this report is asking for councillors to make. To agree.
Thank you, Jackie. Councillor Sexton.
I bet you're pleased I joined CWNH. Jackie, can I ask you a question, please? In terms of going out to tender on this, have you looked at any of the other districts and boroughs for CCTV, please, in West Surrey?
We've looked at others in West Surrey and we've looked at others across the country, and what tends to happen is that CCTV goes to a larger type of call centre rather than the individual service we get from Runnymede. The service that Runnymede provide gives us a greater opportunity, and the police a greater opportunity, in managing to detect crime and manage antisocial behaviour, because they can go and watch what's going on in the control centre, and it works much better than any other CCTV that we've actually explored, the CCTV monitoring that we've explored with other local authorities, both in East Surrey and West Surrey. Although it should be noted that Safer Runnymede is also providing CCTV services for Surrey Heath Borough Council, who are in West Surrey, and also a number of other local authorities outside of West or East Surrey, which is Hart District Council and Rushmore Borough Council. And they also monitor CCTV services for Ashford and St Peter's Hospital Trust. So obviously they're a very reliable and very reliable source, and they do monitor for a lot of people. So I think, it's good that we're with somebody who can provide such an excellent service.
Does anybody else have any questions? Councillor Arnold.
I may have misread, but does the agreement define the responsibility for upgrades, replacement, expansion of the camera network if needed during the contract term?
So it's very unlikely between now and April that we'll actually extend any of the CCTV services, because obviously that's something that would have to be considered when we get into West Surrey, because it creates more of a financial responsibility for West Surrey if we increase it. But basically, the service is about monitoring and maintenance, fault repair, fault response, and also out of hours support. It covers exactly what we have now, plus a little bit more.
Does that answer your question, Councillor Arnold? Does anybody else have a question they would like to ask? Councillor Sexton.
So one last question, Jackie. In the past, we've had issues regarding CCTV being down, and it's taken quite a significant amount of time in order for it to be up and running. What assurances do we have from you today in terms that that's not going to happen? Indeed, there have been cases where councillors have not been aware of that, and when something has arisen and we've challenged it, we found out that they've been down for quite a considerable amount of time. I'm very concerned about the actual maintenance of the cameras that we have in situ already, and I just need some reassurances from you. Whilst I appreciate we need to have something, I have been to the control room many years ago when I first joined here in 2011, and I know that we can, if there's an incident, that they can go back and they can have a look at it, but we need to make sure our CCTV is up and running all the time, and we need to be assured that any service replacements, etc., are going to be done within a very, very short period of time, and I'd like you to give me a heads up in terms of what that timeline might look like should the situation arise and CCTV go down.
Okay, so I think you're referring to, it's fair to say that a while back Runnymede did have a difficult situation with its contractor who does the maintenance and repair, and which did impact on Spelthorne. I think it's fair to say that has now been resolved, and we've had some very good conversations with the contract manager at Runnymede, who I'm pleased to say has now put lots of different items in the service contract that we will get, which will ensure that we get a good service. So the service actually will be looking at maintaining 56 cameras. We will have 2 proactive maintenance visits for each of those cameras every year. Before now, that's been lacking, but now having 2 visits will actually make sure that our cameras remain in good condition and properly working order. It'll include fault identification. So it will always happen that sometimes CCTV cameras will go down for one reason or another. But there's a fault identification service now put in there, and that will be that's part of the contract. And also we'll have out of hours call out handling. So if there is, emergency issues, then that's something they will be doing. So the call out charges for out of hours, that yes, there is a charge for that, because they give us a cost for monitoring, maintenance, etc., within the standard terms. But there is also in the appendix, which Runnymede didn't wish me to go public with, there are actually call out charges within that, which will deal with urgent faults, which will be a call out level of 6 hours, non-urgent faults will be 3 days, and it's so on. So we're just making sure that we are better covered than we have been in the past, and it has been working this way for a while now, and it's working very well.
Before I allow you to ask another question, can I just ask, does anybody else want to ask a question on this? No, I've got Michelle as well down. Councillor Sexton.
Thank you. What I don't see here is any KPIs or SLAs, so we don't know how this CCTV performance has been managed over the last year, 2 years, and one needs to have that information to be able to make an informed decision. I don't think there's sufficient information. I'm sorry, Jackie. I hate to say this, for me to be able to make that decision tonight. Thank you.
Okay, so there can be and there will be some KPIs within the contract that we sign up to them with. But I will say that the issue we have at this present moment in time, we can sort KPIs out. That's not a problem. I think the basis of this is we need to enter into an inter-authority agreement. At the moment, we won't be able to have a CCTV contract if we don't do something, because to actually procure a new CCTV contract will probably take the best. We probably won't get there until March, and to say that commissioners have also looked at this and they are happy that we enter into this inter-authority agreement. So we run the risk, if we don't actually agree to enter into something like that, that we won't have a CCTV service, because Runnymede could just pull the service from under our feet. So we will make sure that we have KPIs in there. Those KPIs will be similar and very similar to what's in the Appendix A, which obviously is not being discussed at this present moment in time, but they will be similar to in there, because we have given, as I've said, we've got a call out level, fault call out charges, and we will be monitoring basically what they do on their performance in terms of mainly our urgent fault calls, but otherwise we've got the rest of what we need in the maintenance and the service, the proactive maintenance, the fault identification, and also that ability to have out of hours call out. And they will be some very simple KPIs that will be able to monitor what they're doing.
So where is the measurement performance now, so that we can see how well it is working, so we can make that informed decision? One's not saying that we don't need to have this, we do understand that, but without understanding the actual parameters in which that we're working in terms of the measurement performance, and indeed whether or not it is serving this borough effectively, we are unable to make that decision, and without that information we can't.
That's members' decision. If you wish to not put this committee this report through, and you want that information, that will have to be deferred and put forward to a future committee. But that means that we run the risk of not having any CCTV monitoring services.
I've mentioned this before a couple of years ago, Jackie, so I do think we need it. Thank you.
Thank you. And Jackie's highlighted that risk of not having appropriate contractual arrangements in place and not having that arrangement transferred in a safe and legal way on vesting day. So I just wonder, and this is just a suggestion for the committee's consideration, whether if we added something into the recommendations that this decision is subject to the members of the committee or the chairman having sight and reassurance from an appropriate set of KPIs, whether we can make a decision subject to that assurance.
I understand that we need to have a contract in place. Nobody's arguing with that. However, the information before us is incomplete. I'm sorry, but it is. This is not the first time that I've mentioned about CCTV, KPIs and performance. We need to measure exactly how effective it is. All we are asking for, or all I'm asking for, and if members don't agree with me, that's their prerogative to say so. But my understanding is if there's anything that I want to sign off, I need to be assured from officers that actually it's fit for purpose in the first instance. It's all well and good saying we make sure they do that, we make sure we do that. But actually, we need to see how well it is working. That's all I'm asking for. And I cannot understand why there is not the KPIs and SLAs. You don't need to have the ins and outs of everything, but at least a top line to give assurance to members here today that actually it is something that's tangible, that we feel confident about and assured that's protecting our borough.
Sorry, can I just interject? So further to Terry's suggestion, is it possible then that if this is put through this evening, that I meet with the chair of the committee and actually put forward the proposed KPIs that will be within the contract? And again, as Terry said, the report is agreed subject to the chair being happy with the KPIs that I actually put through as a suggestion.
Sorry, I think this needs to come to the committee, actually, rather than just or not even just the chair and vice chair, but I think it needs to come to the committee for everyone to hear. Councillor Bateson.
Thanks, Chair. I mean, I know in the report at 2.2 that our existing contract has already expired and we have in effect not been covered for 2 months. So I'm just curious to know, should this in fact have come to a previous meeting prior to the contract expiring? Because if we're now boxed in a corner, because if we don't agree this tonight, we now know we are not covered. So we've got no, if there's a serious incident within the borough that requires CCTV to be looked at, we've got not a leg to stand on to demand anything while we're not in a contract. You're out of contract, so you're in a rock and a hard place. So, I mean, the problem we've got tonight, if we don't make a decision to proceed with this, then we are not going to be covered until the committee next meets, until September. If there's a major problem, and there's enough sort of things going on in the summer, we are going to look very foolish as a council when we would have to go in that situation and say there's a fault with the CCTV, and then people start digging and find we've had no contract. So that's what concerns me, is that councillors are put in a position tonight where they're in effect got to make this decision. Otherwise, we're already not covered for 2 months and we'll carry on not being covered for a further period. Thank you.
Chair, as if I just quickly come in, just got an idea.
Halkins, sorry, and then I'll...
I don't know if I'm right or wrong or think, but so we're out of contract by 2 months. Does this mean that we are legally allowed to use these cameras? And are we not turning around and imposing any GDP problems and things like that? The other thing is that if there was a problem and somebody wanted to contest something and we're not in a contract, won't that cause us problems as well? So by turning around and saying you're not agreeing to a contract for another 3 months, it's a long time to go 6 months with to be out of contract. So I think you've just got to turn around and, you know, we've had a reliable contract. We've got a very, very reliable member of staff in Jackie, and I think that we just turn around and we progress it. And I cannot see the point in delaying it, because what reason are we delaying it for?
Can I just make a quick recommendation, if I may, Chair?
Councillor Sexton.
There must be KPIs and SLAs. Can they be shared accordingly with the committee within the next week, and it's subject to, yeah, and look at those KPIs and SLAs, and subject to, then we can get together and to agree. Is there any way that we can do that? And I need to add, because this is not the first time we've been out of contract. This has happened before. And I feel myself in a position that I'm very uncomfortable with, and these KPIs and measurements should be in place anyway, one would have thought. And if they're not, then how are we demonstrating how effective we are measuring this provider?
Jackie, do you want to reply to that, please?
Yes, sorry, it was bits of all the questions that I need to reply to. So first of all, Runnymede have already, the reason for the delay, one of the reasons for the delay is obviously the committee processes that we have that take a long time, but also Runnymede also had to go through their committee to get the approval to roll the contract on, and also enter into an authority agreement with us. So this had to be agreed by two councils, and they have agreed to roll it on. That's been documented in their committee. And so yes, we are still covered for CCTV. They have honoured to keep that going. They have been still delivering a very good service, and a service that we can rely on. And one of the other reasons that we hesitated a little while is because we needed to resolve the issue that Councillor Sexton quite rightly stated we've had before, whereby some of the response times have not been what we would have liked. And yes, we have had issues where we haven't been advised that cameras are not working for longer periods of time than they should be. But they were the reasons for the delays in getting to where we are. But we are here now. We know we have a very good, reliable service that we can continue with. It will be monitored. And the decision, that's all I can say really. The decision will be down to the committee as to where they wish to go from here.
So how can we find a compromise to be able to take this forward, subject to the KPIs and SLAs? Can I ask committee services, please?
As a committee, you kind of have two options here. You either allow delegated authority to the chair and vice chair to agree the SLAs, KPIs, or we would have to come back. You can't make a decision outside of the committee, so you would have to come back for another meeting to agree that, if everyone's got time to do that.
Is it possible, in terms of that process of delegating to the chair and the vice chair for, as part of that process, for them to take into account the broader views of the committee as part of that process?
Clearly, if the committee were mindful to filter comments through to the chair, then that's quite happy that they do that. And we could tonight agree it, subject to the chair and vice chair being happy with the SLAs, the KPIs, whatever. But that's kind of the options.
The vice chair's not here this evening, so we would have to ask her outside of this meeting.
We need to make a decision tonight what we're going to do, one way or the other.
Yeah.
So that's the two options. It's over another meeting. I don't know when we're going to put that in, or delegated authority. That's where we are.
Sorry, could I just add, and if we're going to have delegated authority, we need to set some sort of time scales, parameters around that, so that if we could get an agreeable time frame for this committee, then obviously we can get that information back and get that agreed. It's just what we can't do, as has been described, is roll on till September really on what we've got. So if we could go down that route of perhaps the delegated authority and actually set a time frame, a sensible time frame for coming back to chair, vice chair, and then they can make the call. If they feel they need to come back to committee, then it gets deferred to September. But you just build yourself in that buffer.
What does everybody think about that?
I can't see why we can't turn around and vote on it tonight.
What does the rest of the committee feel? Do they think it should?
I think I'd be happy with delegated authority, but within a very concise time frame, so that this is buttoned up.
Yeah, I don't think it should be any long time frame.
No, but I'd be happy to defer it to you, Chair, with the Vice Chair, to make the decision.
Jackie, can you tell us how long you think it will take to get all the information that we require, please?
Okay, well, I will speak to the community safety manager this morning because he manages the CCTV monitoring, etc., or the contract. So I will speak to him in the morning. I would hope that within the next couple of weeks we should be able to get something to you. But obviously, everybody's already got really heavy workloads. But I will speak to him in the morning and ask if we can actually get this before the end of June.
Sorry, so can I ask what happens in the meantime then? Because that's June,
In the meantime,
So
we will
this
still,
con-
because I've already said,
be
because
covered.
we're already covered, because Runnymede have agreed to roll on the contract while we make a decision as to whether or not we wish to enter into this inter-authority agreement. So we are fully covered for all of our services. So everything is covered, nothing is lost. And I have to say that's a measure of their desire to actually continue with the monitoring of our CCTV services, because they have done that. They have been reliable. So I would hope to get this done within the next couple of weeks, but obviously I have to speak to Will first of all. I will work with him, subject to time availability, to be able to get that to you as soon as possible. So where are we today? Tuesday. So I would hope by the end of next week we would have something to you.
Thank you. Sorry.
Thank you. I echo regarding the dedicated authority to Vice Chair and Chair. That's fine. I think what I want to add is SLA and KPIs are the standard procedure for the procurement. It's always clear, especially in these kind of procurement, they must be absolutely clear. So I think going forward, what we really need is, because what we're looking at, how they're going to perform in the remaining contract period. So we need to get that details, and it's a good time, because having that authority to Vice Chair and Vice Chair, we can have a data ready in September. So what I would like to see in September, how they are measured in terms of performance until now, and from now to September. That would be quite key, because this is quite critical for our borough in terms of safety. So this is not something we can delay, and we definitely need to see the data on the performance. Thank you.
I think we need to know the performance in the past, as well as that going forward on for now as well. So we need to know we're covered across the board, don't we?
Sorry, do you mind if I just interrupt there? So I've already relayed the fact that we accept the fact that some of the performance in the past hasn't been at its best, which is why we have worked hard with Runnymede to make sure that we get what we need from now on. So monitoring the past is probably not going to be very helpful. What we need to do is monitor the performance going forward. But obviously, until we've entered into a contract, we're not going to be able to, we don't necessarily have the ability to insist on KPIs where we're rolling on the existing contract rather than having a new one. So yes, we can monitor KPIs, and they will be, as I said, based on what the detail that you have in Appendix A about fault call out and response times and repair times, and the full identification, etc. They will be the main KPI performance indicators we'll look for. But we need to enter into a contract with those KPIs in them so that we can monitor performance. Past performance at this present moment in time would be irrelevant because we know it wasn't before the Runnymede sorted the issues out with their contractor, their maintenance contractor, wasn't at its best, but it now has improved drastically.
Sorry, may I add on this? Yeah, SLAs are really, really important because I can see urgent call out. It says 540 plus quid, right? First,
Can I stop you?
sorry, let me finish. So that's what it costs.
Can I stop you? That's a confidential appendix.
Oh, sorry.
Information
So
we can't be
yeah,
discussing.
on addition, on the top of that, that's actually like there's additional cost. So we need to have a mechanism. If they are not able to meet SLA, they must be penalized as well, because I think that clause must be there, because this is something we cannot compromise. So we have to have those terms and conditions as part of our procurement procedure to meet SLA.
Last time, I promise. Thank you, Chair. We've been with this company for a long, long time. I'm somewhat surprised that we do not have any performance measurement. Whether or not we have managed to get them to a point where we're more comfortable is irrelevant. There should have been KPIs and SLAs that we should be measuring over the past. And indeed, if we've now got to agreement whereby we are comfortable with the improvements, then it should only be looking better for Spelthorne. Thank you.
So at the moment we're discussing KPIs. We've got 10 months left in this council. So we want to know what figures we haven't got, past call-outs and call-outs. We know that we've got to, so what is our option? That we turn around and we hold up everything to get these KPIs, and then we turn around and we do it anyway, because we're staying with this company for this contract? Or are we turning around and then saying, well, actually, we're going to go to procurement and change and go to another contract? So we're holding up for something that we're not actually going to act on or change. We're just holding up for information.
With all due respect to Councillor Halkinson, through you, Chair, we're not. What we want to do is we want to ensure, as we want to be assured as councillors, that the KPIs and the SLAs that are being put forward are indeed making sure that Spelthorne is provided adequately, and we as councillors are assured that we're comfortable with that, rather than just some words in the nicest possible way that it will be okay on the night. What we want to know is that we are definitely going to get some measurement that is going to be satisfactory, and KPIs and SLAs accordingly. I don't know how much more to say it. They should be there anyway. They should be there. We should be monitoring them. It's part of the process. But if we can now decide on how we move forward, which is where the Chair has just said, if I may say, is that Jackie has very kindly said that within a week or 2 weeks, because she must have the KPIs and SLAs anyway, then that information will be at hand, just needs to be provided, and then it can go through accordingly under delegated powers through the Chair and Vice Chair.
But we do need accurate information, and that's a definite. Grant, did you want to speak? Councillor Hawkins, do you want to ask a question?
Just one quick thing. So you get the KPIs on this, and they're not what you want them to be. What are you going to do?
Are you asking me, Councillor Hawkins?
You're the Chair or yourself?
If there's something there that isn't quite right, then I would turn round and say to the chair that something needs to be added.
No, what are you going to do if the
We
if the
should have
things
it
aren't
that
right?
the information is correct, surely, from the start. But we can't guarantee that, I know.
So I was going to suggest, at the end of the day, if the information doesn't come back the way you want it and you really are unhappy with it, then you could call another. That's when you could call an extraordinary, couldn't you, I presume, and discuss it further. But hopefully we'll get to where you've got the information you want, so you've got a way forward. So that's the task we've got, to get the right information to you. So.
But it's not just the information that we want, is it? It's the information that we need.
Absolutely, yeah.
It's got to be correct rather than what we want, sort of thing.
Okay, listening to this, we would need someone to just propose that you add that or change the recommendation to include, KPIs, and obviously, yeah, you okay?
I'm happy to propose that if anyone wants to second me. Thank you.
Okay, so if I just read out the proposed wording to change the recommendation. So it's proposed that we approve the council entering into an inter-authority agreement with Runnymede Borough Council for the delivery of CCTV monitoring and maintenance services for a term of 2 years, with an option to extend for a further 1 year, subject to mutual agreement between both parties and subject to delegating authority to the chair and vice chair of Community Wellbeing and Housing Committee to approve the KPIs and SLAs by 12th of July 2026, and then to approve a maximum contract value referenced in 3.1 and as detailed within exempt Appendix A in accordance with the appropriate level of delegation as set out in the Speltham Borough Council Constitution, and delegate authority to the Group Head of Corporate Governance to finalise and enter into the agreement and any ancillary documentation, including any minor amendments.
Sorry if I may, through you, Chair. I think Jackie said that she could do it earlier. I'm sure those KPIs are already off the shelf and the SLAs, one would have hoped. So perhaps we could do it earlier. If they think we can do it earlier, then so be it.
It would need to be earlier because actually I will be away around the 12th and before the 12th of July. So.
Okay, so I think, Jackie, you said end of June you'd get the figures, or are you saying a couple of weeks and then the decision made by the 30th of June? Is that?
It's not figures, sorry.
So,
it's not figures, it's service level agreements
yes,
and
but
key performance indicators and the measurement tool in which that we are measuring it with.
So just once obviously we've got the date in here, that's the drop dead date. So if, Jackie, you think that can be met by the 30th of June and everybody can make a decision by then, is that what we're agreeing?
Yes, I'm more than happy to make sure that we have that detail by the 30th of June. Before the 30th of June, I would hope to have it by the end of next week. I just need to speak to Will, because Will is the owner of those of the contract performance monitoring that we have at the present. So we will speak to him. The KPIs will be and service level agreement will be as per the confidential appendix. So yeah, it shouldn't be too difficult to actually get the detail together, which will be detail for future contract monitoring, if I can be really clear on that one. Future contract monitoring rather than past contract monitoring. If we have to go into the past, then I think it's unlikely we'll make the dates. But if we're looking for monitoring in the future, yes, I will make sure that we have that detail by the end of next week. So yes, by the end of June, hopefully this will all be resolved.
What's the committee, does the committee agree to that? Agreed. So that's agreed then and carried. Thank you.
Do you think we could have a short break, please?
Yes, with pleasure. Yes. Is everybody in agreement that? Can I have a proposer, please? And thank you. And seconder. Thank you. 5, 10 minutes at the most, please. Can we take our seats, please? Is this the right one now? Terry. I'll pass you to
Chair.
Terry, please.
Thank you, Chair. So, nightly paid temporary accommodation has been an increasing pressure for this council as well as many other councils, and we are in the midst of a housing crisis, and the level of spend we have been incurring on nightly accommodation has been going up significantly in recent years. Last year, the gross spend was just under £3 million, and the net spend was just under £1.8 million. And if we have time later in this agenda, we've got a presentation from Karen Sinclair relating to a deep dive undertaken by the Ministry for Housing, Communities and Local Government end of last calendar year. And they highlighted many positives, but they did, one of the learning points or recommendations was they did make the comment that we are over-reliant on nightly paid temporary accommodation. And this also feeds very much into the context of the Improvement Recovery Plan and relates both to the commercial regeneration and housing priority theme, but equally, given the significance of this spend on our revenue budget gap, it also links into the financial sustainability Improvement Recovery Plan priority. And as you all note from the report, there's a very detailed action plan, and which has been in place for a while, and we've been firming up the targets, and it's been very much a project which has been led by the Housing Options team, but with close support and collaboration with the finance team. And you will note that in approximate terms, we're aiming or looking to achieve an in-year saving of about £600,000. And there's three main elements in terms of the drivers for achieving this, which are listed in the recommendations. So one is around reducing the total number of households in nightly paid accommodation, which at one point, at the beginning of this calendar year, were over 100, and for that budget saving target of 600, what we're working to is achieving a reduction to no more than 50 by the year end. The second element is actually reducing the average nightly cost of accommodation by 5%. So this is the amount we pay to the provider of that accommodation. And then thirdly, reducing the average length of time households spend in nightly paid accommodation from 215 days to, in last financial year, to 120 days. And whilst I've mentioned the financial context, I also want to draw attention to paragraph 2.2, because it's not just about the financial costs and pressures on this council. It's also about the impacts on the families, particularly those families with children, in terms of being in nightly paid accommodation for extended periods of time, which is not a good outcome for those households, and doesn't help in terms of, as the paragraph says, encouraging helping their well-being, safeguarding and educational success, etc. So this is not just about money. This is the right thing to be doing, and then you'll note in the appendix the various elements, particularly on page 134 and in the section under how are we going to deliver it, and you can see there's actions A to H, and they are being monitored on a very regular basis, and we recognise there are challenges, and whilst we made some good progress initially, it is going to be hard work, but we have brought in additional resource and support for the Housing Options team, because this is a really important priority. And so this all as I say, this will feed into and will be a significant part of the overall savings target, which is built into the budget of £1 million. So potentially this could deliver in the ballpark of about 60% of that savings target. So it is a significant element. But as I say, it's not just about the financial savings, there's the other outcomes as well. So that essentially is the proposal. Thank you.
Does the committee have any questions, please?
No question, just a comment. Just want to say, brilliant, absolutely brilliant job what you've done over the last 6 months especially. Yeah, great work. Thank you.
Anybody else have a question they would like to ask? Oh, Councillor Buck.
Of reducing nightly paid accommodation from 100 to potentially 35 by March 2027. But on the other hand, the charity shelter has predicted an increase of 8% of homeless people compared from 2024 to 2025, and this is going to increase. And then you set a very ambitious target to reduce that in 2 years to from 100 to 35. What assurance can the administration provide that vulnerable residents will not be pressured into unsuitable accommodation, and how are you going to achieve this? Is it feasible?
Thank you. As I said, page 134 to 135 sets out a number of ways in which we are looking to deliver. And part of this is about increasing the supply, working with A2 Dominion to reduce their length of voids, working more effectively with developers and registered providers to increase supply of affordable housing, utilising the commuted sums we have from time to time, and using those to purchase street properties, etc., for temporary accommodation, and then working with the households in nightly paid accommodation, provide support, working to improve our engagement with the private rented sector. So there's a whole range of measures, and we're not denying, as I said, that this is not challenging. And whilst sorry, Councillor Buck, you highlight the more aspirational target of 35. In terms of our assumptions, in terms of what we are assuming we'll save in terms of financial benefit, we're actually using a slightly more cautious or prudent target of getting that down to 50. So we are mindful of the challenge, Councillor Buck, you're raising. Thank you.
Can I ask an additional question, please? So one thing which is very striking in this document, you state that the equality impact assessment will be undertaken. Why this committee is being asked to support such a significant transformation target before the equality impact assessment has been completed and presented to the committee?
So we're obviously very mindful of this, and we will always take into account and are doing an equality impact assessment for all of the households affected each way. But part of that is also about managing expectations of clients as well, and about the reality of the housing situation about there and what they can expect at the end of the process. So of course we will always accommodate proven medical needs and so on, and that is a huge factor in everything, but I think we have to balance that with aspirations and people's wants. You know, for example, in theory, as you've heard us say before, people all would like houses with gardens. The reality is most people will be looking into the private rented sector. There is not enough social housing, so it's all things like that. But in terms of actually meeting people's needs, in terms of, you know, the protected characteristics and so on, absolutely they're all evaluated and will be accommodated.
Last comment. I noticed the language used increasingly frame homelessness as a financial pressure in the report. There's a serious concern about the document presenting homelessness as a budget problem rather than a human crisis. For example, reading the reports, a repeated reference made on reducing cohort numbers, saving targets, reducing costs, reducing placement, financial recovery. Of course, we all agree that financial discipline is important, but there's less emphasis on safeguarding, less emphasis on trauma, mental health, family stability, all these has been probably disregarded. I think, as a council, we must ensure that vulnerable residents do not or are not viewed primarily through the lens of cost reduction. We have to be more sensible to the problem of homelessness, which is not only national but international concern.
I think we agree and support that, which is why primarily we want to get the length of time that people are in accommodation that is less than suitable, in the sense of nobody wants to be in nightly paid accommodation that's away from schools, and having a permanent address where people can make those community links, support networks and things. So it's a key part of driving down the numbers and the length of time so that people can have the more permanent solutions. But it's a very complex system, isn't it? And the private rented sector is a huge part of that.
Councillor Hawkins.
I get, you need to reduce it for financial thing, but people don't choose to get in this situation, but they end up in it. So what happens? Where do they go? They've turned around, you come up, it's the middle of August. Your target for your budget is 74. And and your internal delivery target is 69, and I'm number 75. What happens? Do I just get told go away?
No, sorry. We always have a statutory responsibility to help people, but it's really important to remember that a huge part of the process is the prevention side of it. So ideally, people come to us at an early stage when they're threatened with homelessness, and we work together to find solutions at that stage, and we put an awful lot of work into that. And if I do get time to do the presentation, that's something I will say that actually MHCLG have said we need to be promoting our prevention work a bit more and having acknowledgement for what we do on it. So no, absolutely. We want to see homelessness and our assistance as a last resort in terms of temporary accommodation. What we want to do is prevent it happening in the first place. So all the partnership working, all the things that Terry's listed are a big part of it. But there's no one factor that will make it. It's all different parts of the jigsaw. It's very complex.
Okay, so on your list you've got, I don't know, 77 people. Is that 77 families or 77 individual people, including, I don't know, maybe 15, 20 children or whatever?
It's households. It's household numbers. So if we've got, at the moment we have 79 households in nightly paid accommodation, that's approximately, I'd have to look it up, approximately 300 people.
Okay, all right, thank you.
Councillor Geach.
Being a councillor for Stanwell and actually having lived in some of this accommodation myself, A2 Dominion, it's a nice aspiration for them to reduce their void time, but they are very difficult to work with. I'm sure officers have the same experience as councillors, and a lot of their accommodation is in a poor state. So actually, that repair time may not be reduced. In fact, the repair time may not be enough for some of the accommodation that we look into. I don't really have any recommendations except to say that it's very aspirational, and there's a fundamental problem with A2 Dominion. I think it's just a bit simplistic to say we're going to reduce the void time, but I totally understand it's just one part of the jigsaw puzzle.
Sorry, I don't know your name. Guy Wiley, sorry. I beg your pardon.
Thank you. So in my ward, residents who are living in social housing, managed by each dominion, there were a number of cases I dealt with where they had to find temporary accommodation due to repair, maintenance, so on and so forth. So in those cases, who actually bear those costs when these residents have to put in a hotel? Is that council or it's part of a dominion contract?
So usually as you can imagine, A2 Dominion have been hugely impacted, as have other housing associations across the country, by the effects of the Grenfell fire and the need to improve fire precautions and also damp and mould legislation. So yes, as you say, absolutely, there's been a lot of decanting, but in those circumstances, those are not the people that are coming to us, but it has hugely impacted on our availability of voids that we can nominate into. But no, A2 Dominion have been managing those within their stock, but it means that has contributed to the reduction in availability for the people that we're trying to have. In the nicest possible way, the people who are already in the social rented sector are better off. We're talking about the people who aren't in there and cannot and will not get into that sector.
My question is more about who bears the cost when these residents stay in the hotel. So it's us or A2D?
The ones that you're talking about to do with moving from A2 Dominion is A2 Dominion. They are bearing, it's not the council.
Does the committee agree the targets set out in the nightly paid accommodation delivery plan as follows? Target 1, reduce the total number of households in nightly paid accommodation to fewer than 35 by April 27. The target for budgetary purposes is 50 to allow for contingency in the 26-27 budget. And target 2, reduce the average nightly cost of accommodation by 5%. And target 3, the average length of time households spend in nightly paid accommodation to reduce from 215 days in 25-26 to 120 days by March 2027. And another two, recommends to Corporate Policy and Resources Committee that the anticipated savings of 600k arising from the nightly paid accommodation delivery plan to be incorporated into the overall budget savings plan for 26-27. Agreed. So that is agreed. No, sorry, Karen. So that's all but one.
So I suggest I literally go on to jump a couple of slides and just introduce it. Is that all right? Right, yeah. Hi there. So this is very much linked, but I'm very mindful of time. So I was going to give a more comprehensive presentation, but I suggest that we circulate the slides later and the link to the full report. But just to give you a context, that as part of the Council's Improvement and Recovery Plan for regeneration and housing, we asked MHCLG, who have a homelessness directorate and do a lot of all of our monitoring of all our stats and figures, we actually asked them to come into the council and do a deep dive of our homelessness service to assist with all the targets that we've just been talking about, to look at where, if any, the issues were and where we could improve. So we invited MHCLG in, and the purpose of this was just to give you an oversight of the key findings. So I'm just going to jump on a couple of slides and then I'll pick out one or 2 points and then move on if that's all right. So they came in during December 2025 and they met with the leader, the deputy leader, the chair and vice chair of this committee, all sorts of partners, management team, and case officers as well. So a very, very comprehensive review of the service, looking at all the statutory returns and data available. You won't mind moving on? So this is a summary sheet. Don't expect you to read it from here, but I'd just like to point out a couple of things for you overall. So I think the first thing to say is that overall MHCLG were really impressed. I think that came back very strongly from the feedback of the service that we offer, but there are lots of caveats, and I think, to be fair, most of them have been covered in the presentation, in the discussion that we've had of the report myself and Terry did about the financial savings and so on, namely that there's too much reliance on nightly accommodation, nightly paid accommodation, and people are staying there too long. So we accept that that's a given, and also, as I mentioned before, that there is some underreporting of what we do. And similarly, we could be doing more with the private rented sector. We need to look at the modelling and the sorts of schemes that we've got. So it's very important to say that there are lots and lots of recommendations and things that, as a result, we've incorporated into the action plan under the improvement and recovery plan for housing. So those, lots of those have been incorporated. But on a positive side of things, I would like to say, and I hope you would agree, that the external advisors found that the leadership here, senior leadership support and councillor support, and that includes everybody on this committee, was excellent and is excellent. And I do endorse that. And that was there was a clear understanding for everybody who attended of the needs and the pressures of the homelessness service. So I think that should be acknowledged and credited. Thank you. And they found that in comparison to other authorities, we have a really good front door service for the clients who are homeless and in need. You know, it's accessible and people are assisted and not made to feel inferior or, you know, the stigma around it, and that they're dealt with very professionally and thoroughly. And then finally, at the moment, just to say that they were also very complimentary of our professional approach, that the officers that we have are supported with training and all sorts of things to make sure that we have consistent decisions and they're supported in their future development, and very positive team cultures. There are a number of the slides which in a way cover some of the areas that Terry has talked about to do with the things that we're doing to help this. You know, I won't go through them all now because they're all the ways that we are going to help reduce this reliance on nightly paid accommodation and so on. But just to say, you have our assurances that we're absolutely doing everything we can. There are areas that we can tighten up on, and we are doing that on a daily basis. And that trajectory one shows how we are already on the way to achieving those targets, financial and for the households. As I'm the first to fully support this. I know Councillor Doran in particular really shares all of the values that you've all mentioned, so I think we all totally agree with those. But we are on the way, and there are lots of caveats, lots of risks around all this, but we will absolutely do everything we can to achieve that. So I suggest, if that's all right, I finish there, unless there's any questions, and then we'll circulate the slides and the link to the report. Would that be okay, because of time? Thank you.
Is there anybody, Councillor Beach?
Sorry.
Just a very quick question. I know you were talking about buying up properties. Do you, by any chance, buy up ex-council housing or ex-social housing properties? So, for example, I lived in an A2 Dominion flat in Laleham, but I owned it as a leaseholder and then sold it. So do you ever buy back that property?
So when we are looking at opportunities, absolutely, if they are known to us and available, yes. However, I have to say, sometimes we're told of A2 predominantly properties that are for sale, but the reason that they're selling them is because they're not viable to repair. So we would also be in the same position, but absolutely we will consider all sorts of opportunities. We're very open to all that.
Item number 10, proposed council transitional plan. Lee, please.
Yes.
Sorry, can we stop a minute, Lee? Sorry, we need to be asking.
I haven't got that. What page is it?
Literally does a committee note. Presentations, we just need them to agree that.
Which one's that? 11, I haven't done that one. I've asked this one, I haven't done that one yet.
Yeah, sure. This is what we're on. That's what we're on now. We've just finished. So you just want to make sure, does the committee note?
Does the committee note the presentation?
Agreed.
Agreed.
Right. And now we need to go into part 2.
And now we need, do I have a proposal for part 2, please? Councillor Bates.
Not part 2, we're going out of order.
Oh,
sorry, we're going out of order. Here.
Is that her fault?
We're all over the shop now. We're on number 10. Sorry, page 12.
Chair, could I move that we suspend standing orders in order that we can complete the business of the meeting tonight?
Does anybody second that, please? Thank you, Councillor Sexton. Is everybody else in agreement? Yes. Agreed. Thank you. So which number are we on now? 10. It's all right. They've confused me. One's saying one thing in one ear and one in the other. So, item number 10, proposed council transitional plan. Lee, please.
Thank you, Chair. I'll try and be brief again as, in view of the time. On Tuesday last week, a proposed council transitional plan was endorsed by the Corporate Policy and Resources Committee for consultation with the council service committees. We delivered a lot under our corporate plan, which was for 2024 to 28, but due to a range of significant constraints now, including we've had best value, commissioner intervention, we've had increased pressure on some service areas, including, for example, HMOs, which we talked about earlier, and in particular, local government reorganisation. It's no longer feasible to deliver all those actions we've had listed in the corporate plan. So the proposed transitional plan was designed to provide a clear and focused framework for the council's final phase as an independent authority. And we built the plan, you have before us, around the existing CARES corporate priorities, so we made sure it's familiar to you and it fitted with the general direction of the corporate plan. And obviously we try to reflect the current environment we're working in, whilst also the imperative of delivering statutory and discretionary services that are valued so much. All the actions within the transitional plan that we've outlined are expected to be delivered within the existing budgets and resources. And as we've set the 2026-27 budget, any additional actions that's proposed are going to have to be accommodated within current financial and staffing resources. We're therefore asking members of service committees to have a look at the list that we've outlined there you have before you to identify how any new proposals that you might have could fit in with this, and if so, how they would be funded, and in particular we'd be looking at if, for instance, you come up with something that was completely new, what we would be looking to end in order to deliver that new idea. Similarly, any of the things we've got listed there, if there's any sort of adjustments or amendments to those you're proposing, again, we're willing to consider anything, and that's part of the process we're going through. But obviously, we've got to just be mindful of those financial and staffing constraints that we're trying to work within. Now, what we've done with the table we have before you, we've highlighted, Terry and I went through them and just highlighted in yellow the ones we think which were pertinent to this committee, and they cover areas such as antisocial behaviour in community facilities, housing delivery, HMOs, use of temporary accommodation, engaging with our community groups, and common to all of the committees is service delivery as well. And also one of the things we've highlighted in there is for obviously all committees to consider how their services transition into the new West Surrey Council. So the idea tonight was to, and we haven't got much time to talk about this in great detail now, but was to get some feedback from the committee in terms of any areas you feel might be significant omissions or anything you feel needs changing, so that we can then feed that back into the process and go back to CPRC, Corporate Policy and Resources Committee, on the 13th of July, and then from there to get a recommendation to full council to adopt this as the new council transitional plan to take us through to the end of Spelthorne's existence as a sovereign authority. Obviously willing to take happy to, Terry and I, obviously answer any questions you may have and consider any issues you might want to raise tonight. But we were just discussing in the break, in view of the timescales, if you do have anything you want to feed into us, we'd be happy to receive anything from members of the committee in writing, email or whatever. And I'm just looking at the timetable. We're going out to all the service committees, and the last one we will be going to, their next committee meeting is the big committee on the 25th of June. So if we could perhaps get any comments back from committee members by the 26th, which will be the end of that week of June, because obviously we'll get Big's comments on the 25th, then we can start trying to build that in so that we can get that into a report for CPRC on the 13th. I'll stop there if I can, Chair, and obviously Terry and I will cover any questions and issues you might want to raise. Thank you.
Sorry. Councillor Hopkins.
Just a quick one. Page 6, a review of the future of Noel Green Estates as a housing provider. Can you expand on that, please?
Yes, so this is an issue which we have been discussing for some while. We did have a Corporate Policy and Resources Committee at the beginning of 25, which was looking at some options, and this does link in very much with the local government reorganisation context. So one option, and which will be obviously set out in terms of analysis, would be to actually bring the housing units of Noel Green Estates initially onto the balance sheet of the council, and then transfer the majority of those into the housing revenue account of West Surrey, which will have a very large housing revenue account. So there will be, as I say, a report going later in the year to Corporate Policy and Resources Committee, which is the shareholder representative, but we're highlighting here because obviously this is the Housing Committee as well. So that is the context of that one. Thank you.
Does anybody else have a question for Lee?
One quick one, if I may, Chair. So the ones in yellow you're recommending, I've just read them all, and from my perspective, I think they make sense, absolutely, for sure. That's all I wanted to say. Thank you.
Thank you very much.
Thank you. If no one else has any questions, does the committee agree to provide the comments as discussed during the debate to form part of the proposed transitional plan? Agreed. I think that's agreed. Thank you. We now need to go into part 2, I believe. So can I have a proposer for that? Councillor Bates and second. Does the committee agree to go into part 2? Agreed. Thank you.